This is Dr. David Dahlman, and welcome to the first in a series of video consultations about irritable bowel syndrome, or as we call it, IBS. This is the same information given to patients who schedule appointments in my office or to those from around the country who schedule phone consultations with me. Normally I charge for the first consultation, but I wanted to make it available to more people, so it's now free on video. The purpose of the consultation is to emphasize the key points from my 35-page free report about how to conquer IBS, which I hope you've already read. If not, the report is available on my website at drdahlman.com. Now, what are we going to accomplish in this series of video consultations? Well, we will discuss what IBS is and why you have it. I will then discuss my proven and very successful protocol combining natural supplements and temporary, hopefully temporary, dietary rules that are described in detail in my report, again, at drdahlman.com. We'll also talk about possible lab tests that can be helpful under certain circumstances and my step-by-step thought process, the real strength of this protocol that I take every patient through, allowing you to know what to do at any given stage of your treatment so you can conquer IBS without me. Okay, so let's talk about a definition of IBS. A common question in my office or in emails from around the country, as patients say to me they don't really even know if they have IBS, their doctors aren't sure, so will my protocol work for them? The answer is an absolute yes. The definition of IBS is any uncomfortable symptoms associated with your gastrointestinal system. It's really that simple. You have gastrointestinal symptoms, you're uncomfortable, and you want them to go away, right? More specifically, the most common symptoms, but possibly not the only symptoms of IBS, are gas, bloating, indigestion, heartburn, reflux, diarrhea, constipation, alternating diarrhea, constipation, abnormal bowel urgency, abnormal bowel frequency, pain, spasms, vomiting, hemorrhoids, anything that makes you uncomfortable. Now, why would you have those uncomfortable symptoms? The primary reason, not the only reason, but the primary reason is the use of antibiotics. What are antibiotics designed to do? They kill bacteria. You took them for infections of any kind and they did their job, but they had the unintended consequence of altering the levels of beneficial bacteria that are absolutely necessary for proper human health and gastrointestinal function. Now, there are also secondary reasons such as prescription medications, over-the-counter medications, poor diet, adult beverages, and of course stress. Now, what happens when you take these antibiotics? Well, it begins a cascade of events beginning with the change of optimal levels of beneficial bacteria. Then in time, the chemistry of the gastrointestinal system also changes. Then again, given enough time, symptoms will develop. Everybody gets their own set of symptoms, and the timing of the onset of these symptoms is different in everyone. And it doesn't matter if you've taken 2 courses of antibiotics or 200 in your lifetime. It doesn't matter if you took them all as a child, haven't taken any in years, or took them throughout your lifetime. Each time you did, you altered the balance and, congratulations, you began your path towards IBS. So what have we learned in this video? We learned what IBS is, why you have it, and that there is an all-natural protocol available to you by following my advice. In the next video, let's talk about why this protocol will be so successful for you and the 9 variables the treatment addresses and medicine doesn't, and describe all the natural supplements I recommend for you. Please click on the second video. Thanks.